Welcome back. We're glad to have you still part of the Heart of Giving. Segments go by so fast that so much information is given that we need a longer time for everybody. But this next section I know you will enjoy. I remember it years and years and years ago because I hate to age myself, but Evelyn DuPont started this. It was called Pools for the Handicapped. It has evolved into something that is just phenomenal. And I'm so glad that Henry Helms is here to tell us about it, the director of, and he's going to introduce Pat to you. So Henry, tell us, you've been there 7 years.
Correct.
And you're a physical therapist.
Right.
And you are there watching it all the time to make sure that everything goes right, correct?
Correct. I'm the director of physical therapy.
Okay.
And I work alongside with Pat. This is Pat Dixon. She's the executive director for the pool program.
And she's been there 15 years.
Yes.
Right.
Very good.
Right. And she makes sure that the program's running and we keep the doors open. And I make sure that patients that come in under doctor's care get physical therapy in the water in a safe manner and progress and make gains so that they can improve their quality of life.
Well, you know, just recently it seems as though there's been a great deal of information about what water does to people that can't use their legs. And the fact that you can walk underwater, the fact that your arms are so important, and the feeling that they get. So I don't want to go off on a path because you know much more about it than I do, but when it first started it was Pools for the Handicapped, and Evelyn would have children come in the pool and she would help them to be able to use their limbs better. And I know you still do that, but tell us a little bit about it, the scope of it now.
Well, I'll talk a little bit about the therapy side of things, and then Pat can expand on the programs that are offered by the pool in general.
In addition to the, okay.
Right. The therapy program is open to anybody. The pool originally the conception of the pool with Evelyn was for kids mainly and some older adults. Now we serve anywhere from kids all the way up to seniors. And the majority of people that come in are there to see if they can improve their quality of life. They may not have been able to walk previously, or they may have so much pain in their regular exercises that they haven't been able to do much. And we get them in the water, return their ability to walk, give them a sense of that they can move and exercise and get that pain relief, and give them hope again that they can move beyond whatever injuries they may have.
Because they're buoyant.
Correct. The water provides sensory input to them, it provides support, it provides heat and pain relief, and it provides exercise resistance to exercise. And the harder you work against the water, the harder it pushes back, and the easier you move, the more ability to move it gives you. So it's a very forgiving environment.
And you have all ages.
All ages. We have people that come in that are quadriplegics, that can barely move their arms and legs, to people that are just have severe back pain, disc pain, that they need that pressure relief, that the elimination of gravity that water provides.
And I have a friend who's in her 90s, I think, that uses the pool.
Yes, we get people in there who are in their 80s and 90s that find that they can move again, that they can stretch, that they can increase their mobility and exercise for an extended period of time without feeling the aches and pains that they would feel if they were trying to go exercise on their own at home or in a gym.
Now, do the physicians give the prescription, and are more of them finding this out, or can you just walk in? Tell us about how you get into the pool.
Well, a lot of referrals come through physicians in the area. We have rheumatologists, neurologists, we have orthopedists, we have general practitioners that see the benefits of aquatic therapy. Maybe it's a patient who said, oh, we saw a friend who went to the pool. Doctor, can I try it? And sometimes the doctors are educated by their patients on the benefits of aquatic therapy.
Can you give me just an example of somebody?
Sure. Well, Pat, you remember Larry. He still comes.
Yes.
Well, Larry came to us. He was unable to ambulate. He had multiple problems with injuries to his spine and other diseases. And he was a big guy, and he was not able to walk outside the water. And he came to us in his electric wheelchair, and we worked on getting him in the water and doing standing, and eventually we had him walking back and forth in the pool in chest deep water, and he's since comes on his own now with a caregiver, and he continues. It's a lifetime effort for him now to keep his progress up to snuff.
Well, it just seems that example would give someone such a feeling of accomplishment and hope. You know, just the buoyancy of the water. That's marvelous.
Yes, and there's no other place, no other way that you can get that elimination of gravity and be able to exercise so effortlessly and get the benefits than in the water. That's the only way you can do it.
Tell us about Pat.
Well, Pat's the executive director, and she found me, and she asked me 7 years ago, you know, would I like to assist with the program. And I had done therapy previously in the water as in college, and I was very interested in doing so. And I'm very thankful that Pat brought me on board. And Pat can tell you a little bit about the pool program outside the therapy. We work together, and it's a great symbiotic relationship for everybody.
So Pat, you kind of coordinate everything that happens in the pool, like the therapy, you know, is being taken care of, but that has to be coordinated with the other things. What are the other things?
Well, thank you first of all for the opportunity to be on your program. And we know that you do have a great history with the pool. And as you said, our founder, Evelyn DuPont, started the pool in her backyard to provide swim lessons to children with special needs. And over the years, the program has evolved into where we now provide services to the elderly as well as anyone who needs to rehabilitate in a warm water environment. And that includes, we have some of the largest water exercise classes that you'll find in Southern California.
To go to class?
Yes, wellness exercise classes. People come from near and far as Newport Beach to Topanga Canyon, if you could believe that, for our Warm Waters of Hope, because we are an indoor, year-round facility. Our water is heated 94 degrees, which is nice and warm. And so we provide the ideal environment, as Henry said, for rehabilitation and wellness. So in addition to the water exercise classes that we have for seniors, we have a veteran water exercise class. We serve many veterans in our rehabilitation as well as our wellness program. We partner with various local organizations for program referrals. We also provide therapeutic swimming lessons for children with special needs. And we serve children with autism, that's our greatest population right now, cerebral palsy, spinal bifida, many other physical challenges that children may have. And we also provide a wellness brown bag for health, where we invite speakers from the community to come and share valuable health and wellness information with the community. We provide services to nutrition as well. So we have expanded our program over the years with the goal in mind to keep the legacy going of our great founder, Evelyn DuPont.
Very good, Pat. But you also told me about something that I didn't know. You are also the community pool.
Yes.
Tell us about that.
Yeah, we are.
For swimming.
Yes. We are located in North Long Beach, and we are the community pool, as you said, for the local children, where each year we serve between 400 and 500 children, where we provide free swim lessons. In addition to swim lessons, we provide nutrition education to the children and the families, the parents.
Well, there's so many things at this pool. I mean, it sounds as though it's as big as the ocean to take care of all the problems that and all of the joy that water brings. So do you have that problem that there's just, you could use a second pool?
Yeah, the demand is great. As you can imagine, more and more people are realizing the benefits of exercising and rehabilitating in a warm water environment. And I might add, our oldest client that we know of right now is 105 years old.
No.
And he swims laps in our deep pool.
No.
Yes, 2 to 3 times.
And he walks in?
And he drives himself to the pool.
He drives himself?
He drives himself.
Oh my.
Yes.
I won't tell anybody that.
So, yeah, the demand, as I said, is great, but we do try to divide the program, as much as we can. We do have 2 pools. We have a shallow pool, and then we have a deep pool for lap swimming.
Yeah, and Pat had mentioned, kids with cerebral palsy and autism, and the water provides a wonderful environment for those kinds of kids. For one thing, the summer program teaches swimming, and those kids need to learn to swim also. And then secondarily, the pool itself, the water, provides a calming effect. It allows them to get confidence again. It helps them focus on tasks, and lets them integrate and work with people in ways that they might not be able to outside the water.
Well, I mean, I think people realize that water is therapy, but not to the extent that you're doing. They don't realize that what really happens when you use it as therapy. And I know as you were working with vets, I know the vets organization sends some of the disabled vets to you that need that help. Well, so much is happening in the city of Long Beach, and people don't know about it. But now they know about the Aquatic Center, and for wellness also. The pool that Evelyn would probably be excited about knowing to reach this extent. And I thank you very much for being here. It was very nice to have you.
Thank you for
Henry,
having
Pat.
us.
Thank you, Beverly.
Okay. And thank you for watching, and I hope you learned something new, because every segment is something new that people don't know about, but it shows the heart, it shows how people care about people. And I forgot to even ask you, you need volunteers for things too, don't you? Not lifeguarding, I know that, and not therapy, but I know that you have a lot of projects where you could use volunteers. So keep that in mind, and thank you for watching The Heart of Giving.